Hello, my name is Graham Bruger, and this is my project on fibromyalgia. So what is fibromyalgia? The definition of fibromyalgia is that it is a disorder characterized by widespread, severe, often debilitating musculoskeletal pain, abnormal pain processing, sleep disturbance, and fatigue. Patients experience pain and stiffness in the muscles, but there are no measurable findings on x-rays or most lab tests. So how do you test for this? I will tell you in a couple slides. So what is the prevalence of people with fibromyalgia? The prevalence is that 3 to 6% of adults have fibromyalgia. So that's about 10 million adults worldwide. Women are much more likely to have fibromyalgia than men. If we were to say percentages of how many of the people with fibromyalgia are women, it'd be 70 to 95%. And most of these individuals are diagnosed in the middle age, and the prevalence increases with age. So around 30 to 50 years of age, most people are diagnosed. And how do you diagnose? Since there are no lab tests to detect it, and no x-rays can detect any abnormalities in your anatomical features, fibromyalgia appears to be a link of how the brain and spinal cord process pain signals. The American College of Rheumatology uses the criteria of widespread pain throughout your body for at least 3 months. The definition of widespread pain is that the pain occurs both on left and right sides of your body, as well as upper and lower parts of your body. What are the causes? The causes of these symptoms are linked to stress and physical activity. These symptoms may be reduced by stress management and an increase in physical activity. So some days your fibromyalgia symptoms may flare up. That may be because you are extremely stressed, or you may not have gotten enough physical activity for the day. The symptoms. As you can see, there are many symptoms of fibromyalgia. A couple of these symptoms would be deep muscle pain and soreness, morning stiffness, sensitivity to touch, fatigue, difficulty thinking clearly, stress and anxiety, depression, and migraine and headaches. And then on the right side of your screen, you see that there's an acronym for fibromyalgia, and this displays even more of the symptoms. So the most common symptoms and the severity of them is displayed in this chart. As you can see, the muscle and joint pain and pain in lower back have the highest severity, with the most moderate severity out of these. And then third for severity would probably have to be brain fog. So muscle and joint pain and pain in the lower back are definitely the two most severe symptoms that people have reported in the last year. So tender points. This is what I was talking about earlier, how doctors try to test for fibromyalgia. So there are 18 points, so 9 pairs. There are 2 points per pair, one on the left and right side of the body. And what doctors do is they are points where they apply a certain amount of pressure, and if the patient says that they feel pain, then the doctor can characterize a certain amount of these points, which is at least 11 of these tender points, as a major symptom for somebody that has fibromyalgia. And that fact is by the American College of Rheumatology. Laboratory testing. The laboratory testing So since patients with fibromyalgia do not have characteristic or consistent abnormalities on laboratory testing, routine laboratory or imaging studies can help rule out these diseases with similar manifestations and to assist in diagnosis of certain inflammatory diseases that frequently coexist with fibromyalgia. So these tests consist of complete blood count with differential metabolic panel, urinalysis, thyroid stimulating hormone level, 25-hydroxy vitamin D level, vitamin B12 levels, iron level study, erythrocyte sedimentation rate, and anti-polymer antibody assay. So these are just some of the tests that doctors may use in order to rule out other diseases that may be comorbid with fibromyalgia. So pharmacological treatment. There are three main kinds of medicine that are prescribed. The first one would have to be pain relievers. These are over-the-counter pain relievers such as acetaminophen, ibuprofen, and naproxen sodium. And these help to reduce pain. This is probably the most common pharmacological treatment prescribed to patients. Two others would be antidepressants. So Cymbalta, there's a picture of it down here. This is a common antidepressant, which has the ingredient duloxetine in it, and helps to reduce fatigue and helps promote restful sleep. Anti-seizure drugs that have proved to reduce certain types of pain. The big one would be Lyrica, which is prescribed to patients with fibromyalgia, and it has the active ingredient pregabalin. So non-pharmacological treatment. Non-pharmacological treatment, this deals with patients' physiological and psychological well-being. And so some of these would be patient education regarding the disease, the treatment approaches that one could take in order to deal with their disease, good sleep hygiene, and the importance of treating comorbidities that may contribute to symptoms, including mood or sleep disorders. So some different ones that are characterized as non-pharmacological treatment would be biofeedback, diet counseling, massage therapy, acupuncture, cryotherapy, which is cold medicine, which is the way that somebody would treat a disease using low temperatures like ice packs. Thermotherapy and cognitive behavioral therapy have all seen some success in reducing fibromyalgia symptoms. Alternative treatments. A lot of these are water-based therapies. They have been proven to be very effective. Balneotherapy, as you can see in this picture here, is the immersion in thermal or mineral water. And also, one more alternative therapy would be aerobic fitness, such as Tai Chi and yoga, which include mind-body intervention. So exercise as treatment. Exercise is very key when diagnosing and treating fibromyalgia. If someone has not exercised and has these symptoms, their fibromyalgia symptoms may become much worse. So low impact aerobic exercises have been shown to improve symptoms and restore muscle strength in some people with fibromyalgia. Flexibility boosts circulation and eases the muscle stiffness and tenderness caused by the disorder. Resistance training helps to build strong muscles and overcome fatigue and make daily activities easier. So all three of these are very important, and they should be combined in any exercise prescription in order to get the most out of your exercise and to improve fitness for that individual. So this is a small chart of a couple of chronic diseases of widespread pain, as you can see over here. Some big ones would have to be the rheumatoid arthritis, systemic lupus, ankylosing spondylitis, osteoarthritis, diabetes, endometriosis, hypothyroidism, Crohn's disease, and ulcerative colitis. So as you can see, hypothyroidism and ankylosing spondylitis are two that have a high prevalence of fibromyalgia symptoms. So when treating these chronic diseases over here, you may also have to treat the symptoms of fibromyalgia. Physical therapy. Physical therapy has been shown to be super effective in treating symptoms of fibromyalgia. In physical therapy, the focus is on not only diagnosing the pain and trying to find out ways to help the pain, but it's also on lifestyle changes. And by changing lifestyle changes, you may also be able to help the pain, stiffness, and fatigue that really put a damper on someone's life. Physical therapists help to design specific stretches and strengthening programs to meet an individual's needs and restore overall fitness. So for my case study, it reads, Mary is 35 years old and is experiencing widespread pain, fatigue, frequent headaches, and has a hard time doing daily activities. She has not smoked in 10 years. She does not exercise, but has no family history of disease. Her lab test came back negative for dyslipidemia, but positive for hypertension. She is mildly overweight with a BMI of 27, but would like to start exercising. She would like to start an exercise plan and reduce her fibromyalgia pain. So first, we have to use risk stratification to see where on the risk, risk factor, where she is and how many risks she has. So she has 3 risk factors, and so she is at moderate risk. She is mildly overweight, does not exercise, and has hypertension. Now, this hypertension is a possible symptom from fibromyalgia pain, lack of exercise, and being overweight. So the exercise testing. Since fibromyalgia has no obvious pathology or anatomical change in an organ, questionnaires and tender point tests should be utilized. Questionnaires such as Fibromyalgia Impact Questionnaire and Modified Health Assessment Questionnaire may be helpful to diagnose the fibromyalgia symptoms and see where she is with the disease. Also, submaximal cardiovascular testing will be done. I chose the modified submaximal Bruce treadmill protocol to assess her fitness level. And these tests will be good indicators as to where she is with her exercise and what needs to be done to get her to the fitness level that is appropriate and healthy for her. For her exercise prescription, 20 to 30 minutes of aerobic activity a day, 20 to 30 minutes of warm-up and flexibility routine, and 15 to 20 minutes of strength training, which would be 2 to 3 sets of 6 to 8 reps per major muscle group with a cool down of 10 minutes. So total, this would be about 1 hour every 3 to 5 days a week. In conclusion, fibromyalgia is characterized by widespread pain, abnormal pain processing, sleep disturbance, and fatigue. There are no lab tests or x-rays that indicate fibromyalgia. Questionnaires and the tender points tests are often utilized in diagnosis. Pain relievers, antidepressants, and anti-seizure medication are often prescribed to fibromyalgia patients. Physical therapy has been proven to help improve the quality of life with fibromyalgia. And these are my references. So I hope you enjoyed my presentation on fibromyalgia. Thanks for watching.